Introduction to complementary healthcare. Complementary healthcare encompasses a diverse range of practices and therapies that are used alongside conventional medical treatments. These approaches often focus on the whole person, considering physical, mental, emotional, and spiritual well-being. Unlike alternative medicine, which replaces conventional treatments, complementary therapies are intended to enhance and support existing care. This field emphasizes natural healing processes and aims to empower individuals in their health journey. Understanding the scope and philosophy of complementary healthcare is crucial for effective practice. It involves a paradigm shift from disease-centric to patient-centric care, promoting wellness and prevention. The growing interest in complementary healthcare reflects a desire for more personalized and less invasive treatment options. Many individuals seek these therapies to manage chronic conditions, reduce stress, alleviate pain, or improve overall quality of life. Practitioners in this field often work collaboratively with conventional medical professionals, forming an integrated approach to patient care. This collaborative model ensures that patients receive the most comprehensive and beneficial treatments available. The Diploma provides a solid foundation for navigating this dynamic and expanding sector of healthcare. Designing complementary and alternative medicine (CAM). Complementary and alternative medicine (CAM) is a broad term encompassing healthcare systems, practices, and products not typically considered part of conventional medicine. Complementary medicine is used together with conventional medicine, while alternative medicine is used in place of conventional medicine. It is crucial to distinguish between these two categories to ensure patient safety and effective treatment strategies. Many CAM therapies are rooted in ancient traditions and philosophies, offering different perspectives on health and illness. These practices often emphasize self-healing, prevention, and the interconnectedness of mind, body, and spirit. Understanding this distinction is fundamental for any practitioner in the field. The classification of CAM therapies generally falls into 5 main categories: whole medical systems, mind-body interventions, biologically based therapies, manipulative and body-based methods, and energy therapies. Whole medical systems include practices like traditional Chinese medicine and Ayurveda, which have complete systems of theory and practice. Mind-body interventions focus on the interaction between the mind, body, and behavior, such as meditation and yoga. Biologically based therapies use natural substances, including herbal remedies and dietary supplements. Manipulative and body-based methods involve movement of body parts, like massage and chiropractic care. Energy therapies, such as Reiki, focus on energy fields. This comprehensive categorization helps to organize the vast array of available therapies. Holistic health philosophy. Holistic health is a philosophy that emphasizes the interconnectedness of the mind, body, and spirit, viewing health as a state of complete physical, mental, and social well-being, not merely the absence of disease. This approach recognizes that all aspects of a person's life influence their health, including diet, lifestyle, environment, relationships, and emotional state. Holistic practitioners aim to address the root causes of illness rather than just alleviating symptoms. They believe in empowering individuals to take an active role in their own healing process. This comprehensive perspective is a cornerstone of complementary healthcare. The core tenets of holistic health include personal responsibility, preventative care, and the use of natural, non-invasive therapies whenever possible. It encourages individuals to cultivate self-awareness and make conscious choices that support their overall well-being. Holistic health also acknowledges the body's innate ability to heal itself, with therapies designed to support and facilitate this natural process. This philosophy often integrates various modalities, such as nutrition, exercise, stress management, and spiritual practices, to create a personalized health plan. By embracing a holistic view, practitioners can offer more comprehensive and sustainable support to their clients. Integration with conventional medicine. The integration of complementary healthcare with conventional medicine represents a collaborative approach to patient treatment, often referred to as integrative medicine. This model combines mainstream medical treatments with therapies that have demonstrated safety and efficacy, aiming to provide comprehensive care that addresses all aspects of a patient's health. The goal is to optimize health and healing by leveraging the strengths of both systems. Effective integration requires open communication and mutual respect between different types of healthcare providers. It moves beyond the traditional siloed approach to healthcare, fostering a more patient-centered environment. Successful integration can lead to improved patient outcomes, enhanced quality of life, and better management of chronic conditions. For example, acupuncture might be used to alleviate chemotherapy-induced nausea, or mindfulness meditation could help reduce anxiety in surgical patients. Practitioners of complementary therapies often work as part of a multidisciplinary team, contributing their expertise to a holistic treatment plan. This collaborative framework ensures that patients receive well-rounded care that considers their unique needs and preferences. The future of healthcare increasingly points towards these integrated models, prioritizing patient well-being above all else. Aromatherapy, principles and practice. Aromatherapy is a holistic healing treatment that uses natural plant extracts to promote health and well-being. Essential oils, derived from various parts of plants, are the core components of this therapy. These oils are highly concentrated and possess unique aromatic compounds that can have therapeutic effects when inhaled or applied topically. The principles of aromatherapy are rooted in ancient traditions, with evidence of aromatic plant use dating back thousands of years in cultures like ancient Egypt, China, and India. It aims to support the body's natural healing processes and enhance both physical and psychological health. Understanding the specific properties of each oil is crucial for safe and effective application. The practice of aromatherapy involves several methods of application, including inhalation, topical application, and sometimes internal use under professional guidance. Inhalation through diffusers or direct sniffing allows the aromatic molecules to enter the bloodstream and affect the limbic system, influencing mood and emotions. Topical application, often diluted in carrier oils, allows the oils to be absorbed through the skin for localized or systemic effects. Common essential oils include lavender for relaxation, peppermint for energy, and tea tree for its antiseptic properties. Safety precautions, such as proper dilution and patch testing, are paramount to prevent adverse reactions. Aromatherapy offers a gentle yet powerful way to support overall wellness. Herbal medicine. Foundations. Herbal medicine, also known as phytotherapy, involves the use of plants and plant extracts for medicinal purposes. It is one of the oldest forms of medicine, with a rich history spanning diverse cultures across the globe. The foundations of herbal medicine lie in the understanding that plants contain active compounds that can interact with the human body to promote healing and prevent disease. These compounds, called phytochemicals, work synergistically to produce therapeutic effects. Herbalists study the properties of various plants, their preparation methods, and their appropriate applications for different health conditions. This traditional knowledge is often passed down through generations and is now increasingly supported by scientific research. The practice of herbal medicine involves preparing remedies from various plant parts, including leaves, flowers, roots, bark, and seeds. These preparations can take many forms, such as teas, tinctures, capsules, poultices, and salves. Unlike pharmaceutical drugs, which often isolate a single active compound, herbal remedies typically utilize the whole plant or specific parts, believing in the synergistic action of multiple compounds. Common examples include chamomile for relaxation, ginger for digestion, and echinacea for immune support. Dosage, potential interactions with conventional medications, and contraindications are critical considerations for safe and effective herbal practice. A thorough understanding of botany, pharmacology, and patient physiology is essential. Nutritional therapy core concepts. Nutritional therapy is a science-based approach to health that focuses on the role of diet and nutrients in maintaining well-being and preventing or managing disease. It operates on the principle that proper nutrition is fundamental to optimal bodily function, and that dietary imbalances can contribute to various health issues. Nutritional therapists assess an individual's dietary habits, lifestyle, and health concerns to develop personalized eating plans and supplement recommendations. This therapy is highly individualized, recognizing that nutritional needs vary greatly from person to person. It emphasizes whole, unprocessed foods and aims to restore balance within the body's systems. Core concepts of nutritional therapy include understanding macronutrients, carbohydrates, proteins, fats, and micronutrients, vitamins, minerals, their functions, and optimal intake levels. It also delves into gut health, inflammation, detoxification pathways, and the impact of food on mood and energy. Nutritional therapists often recommend specific dietary changes, such as eliminating inflammatory foods or increasing nutrient-dense options, and may suggest targeted supplementation to address deficiencies. Education is a key component, empowering clients to make informed food choices for long-term health. The goal is to support the body's innate healing capabilities through optimal nourishment, promoting vitality and resilience. Reflexology, techniques and benefits. Reflexology is a non-invasive complementary therapy that involves applying pressure to specific points on the feet, hands, or ears, which are believed to correspond to different organs and systems of the body. This ancient practice is based on the principle that these reflex points are connected to various body parts through energy pathways. By stimulating these points, reflexologists aim to promote relaxation, improve circulation, and support the body's natural healing capabilities. The techniques involve specific thumb and finger pressure movements without the use of oils or lotions, making it a unique form of bodywork. It is often used to reduce stress and tension, which are major contributors to many health issues. The benefits of reflexology are wide-ranging and often include deep relaxation, pain reduction, improved mood, and enhanced sleep quality. It is frequently sought by individuals experiencing stress, anxiety, headaches, digestive issues, and chronic pain. During a session, clients typically remain fully clothed, reclining comfortably while the reflexologist works on their feet, hands, or ears. The pressure applied is firm but gentle, tailored to the individual's comfort level. While not a cure for specific diseases, reflexology can significantly support overall well-being and complement other medical treatments. It offers a gentle yet powerful way to bring the body back into balance and promote a sense of calm. Massage therapy. Overview. Massage therapy involves the manipulation of soft tissues of the body, muscles, connective tissue, tendons, ligaments, and skin, using various techniques. The primary goal is to promote relaxation, reduce stress, alleviate pain, and improve overall health and well-being. Massage has been practiced for thousands of years across many cultures, recognizing its profound benefits for both physical and mental health. It works by increasing blood circulation, releasing muscle tension, and stimulating the lymphatic system. Different types of massage therapy exist, each with specific techniques and benefits tailored to individual needs. Understanding these variations is key to effective practice. Common types of massage therapy include Swedish massage, deep tissue massage, sports massage, and hot stone massage. Swedish massage uses long flowing strokes, kneading, and circular movements to relax and energize. Deep tissue massage targets deeper layers of muscle and connective tissue to address chronic pain and stiffness. Sports massage focuses on preventing and treating athletic injuries, while hot stone massage uses heated stones to relax muscles and ease tension. Beyond physical benefits, massage therapy can also reduce anxiety, improve sleep, and enhance mood. Practitioners must have a thorough understanding of anatomy, physiology, and contraindications to ensure client safety and deliver effective, personalized treatments. Proper draping and client comfort are also paramount. Acupuncture and traditional Chinese medicine, TCM. Acupuncture is a key component of traditional Chinese medicine, TCM, an ancient healing system that originated in China over 2,000 years ago. TCM is based on the concept of qi, pronounced qi, vital energy that flows through specific pathways in the body called meridians. Illness or pain is believed to occur when the flow of qi is disrupted or imbalanced. Acupuncture involves inserting very thin needles into specific points along these meridians to restore the balanced flow of qi. This practice aims to stimulate the body's natural healing abilities and promote overall well-being. The philosophy of TCM also incorporates the balance of yin and yang, two opposing yet complementary forces. Beyond acupuncture, TCM encompasses a range of practices including herbal medicine, dietary therapy, Tuina massage, and Qigong, mind-body exercises. Each aspect works synergistically to address the root cause of imbalances and restore harmony within the body. TCM practitioners conduct thorough assessments, including pulse and tongue diagnosis, to identify patterns of disharmony unique to each individual. Conditions commonly treated with acupuncture and TCM include chronic pain, headaches, digestive issues, infertility, and stress-related disorders. While rooted in ancient wisdom, TCM is increasingly integrated into modern healthcare, with growing scientific research supporting its efficacy for various conditions. The holistic approach considers the patient's entire lifestyle. Homeopathy. Basic principles. Homeopathy is a system of medicine developed in the late 18th century by Samuel Hahnemann, based on two main principles: like cures like, the law of similars, and the law of minimum dose. The principle of like cures like suggests that a substance that causes symptoms in a healthy person can, in highly diluted forms, treat similar symptoms in a sick person. For example, coffee, which can cause sleeplessness, might be used in homeopathic form to treat insomnia. This approach views symptoms as the body's attempt to heal itself, and homeopathic remedies aim to stimulate this natural healing response. It is a highly individualized form of treatment. The law of minimum dose involves serial dilution of the active substance, often to the point where no molecules of the original substance remain. This process, known as potentization or succussion, is believed to enhance the energetic properties of the remedy. Homeopathic remedies are typically prepared as sugar pellets, liquids, or tablets. A homeopathic practitioner conducts a thorough and detailed consultation, taking into account the patient's physical, mental, and spiritual properties, and emotional symptoms, as well as their overall constitution. The goal is to find a single remedy that matches the totality of the individual's symptoms. While controversial in conventional medicine, many people find relief and support for chronic conditions through homeopathy, valuing its gentle and holistic approach. Mind-body therapies, yoga, and meditation. Mind-body therapies are practices that focus on the interactions among the brain, mind, body, and behavior, with the intent to use the mind to affect physical function and promote health. Yoga and meditation are two prominent examples within this category, both originating from ancient Eastern traditions. These practices recognize the profound connection between mental and physical states, asserting that emotional and psychological well-being directly influence physical health. They aim to cultivate inner peace, reduce stress, and enhance self-awareness, leading to improved overall health. The integration of mental focus with physical postures or breathing techniques is a hallmark of these therapies. Yoga combines physical postures, asanas, breathing exercises, pranayama, and meditation to improve flexibility, strength, balance, and mental clarity. Regular practice can reduce chronic pain, lower blood pressure, and alleviate symptoms of anxiety and depression. Meditation involves techniques to train attention and awareness, achieving a mentally clear and emotionally calm state. There are various forms, including mindfulness meditation, which focuses on present moment awareness, and transcendental meditation, which uses a mantra. Both yoga and meditation empower individuals to manage stress, enhance emotional regulation, and foster a deeper connection with their inner selves. They are widely accessible and of the profound benefits for holistic well-being. Energy healing. Reiki energy healing therapies are based on the belief that a universal life force energy flows through and around all living things, and that imbalances or blockages in this energy can lead to illness. Reiki, a Japanese technique for stress reduction and relaxation, is one of the most widely known forms of energy healing. The word Reiki is derived from Rei, universal life, and Ki, energy. Reiki practitioners act as a conduit for this universal energy, channeling it through their hands to the client. The goal is to restore balance to the body's energy fields, thereby promoting physical, emotional, and spiritual healing. It is a gentle, non-invasive practice. During a Reiki session, the client typically lies fully clothed on a massage table, while the practitioner places their hands lightly on or just above various areas of the body. The practitioner's hands may feel warm or tingly as the energy flows. Clients often report feelings of deep relaxation, peace, and a sense of well-being. Reiki is used to alleviate stress, reduce pain, improve sleep, and support the body's natural healing processes. It is often used as a complementary therapy alongside conventional medical treatments to support recovery and enhance overall vitality. While its mechanisms are not fully understood by conventional science, many individuals experience profound benefits from regular Reiki sessions, valuing its gentle and nurturing approach to healing. Chiropractic and osteopathy. Spinal health. Chiropractic and osteopathy are two distinct but related complementary health professions that focus on the diagnosis, treatment, and prevention of musculoskeletal disorders, with a particular emphasis on spinal health. Both disciplines operate on the principle that the body's structure, particularly the spine, significantly influences its overall function and health. They believe that proper alignment and mobility of the musculoskeletal system are essential for the nervous system to function optimally. Imbalances or restrictions in the spine can interfere with nerve function, leading to pain and other health issues. These therapies are hands-on and highly skilled. Chiropractors primarily use spinal adjustments, manipulations to correct misalignments, known as subluxations, and restore proper joint function. Osteopathy, while also utilizing manipulation, takes a broader, more holistic approach, employing a wider range of gentle techniques including massage, stretching, and articulation to improve overall body mechanics and facilitate the body's self-healing capacity. Both professions treat conditions such as back pain, neck pain, and other pain, headaches, and sciatica. They emphasize a holistic view of health, considering lifestyle, posture, and exercise as integral to recovery and prevention. While distinct in their historical development and some techniques, both chiropractic and osteopathy share a common goal of enhancing health through structural integrity and nervous system optimization. They are regulated professions requiring extensive training. Naturopathy, a comprehensive approach. Naturopathy is a distinct primary healthcare system that emphasizes prevention, treatment, and optimal health through the use of therapeutic methods and substances that encourage individuals' inherent self-healing process. The philosophy of naturopathic medicine is based on 6 foundational principles: the healing power of nature, identify and treat the cause, first do no harm, doctor as teacher, treat the whole person, and prevention. Naturopathic doctors, NDs, combine scientific knowledge with traditional and natural forms of medicine. They are trained to diagnose, treat, and manage patients with acute and chronic conditions, while also focusing on disease prevention and health promotion. This comprehensive approach considers all aspects of a patient's life. Naturopathic treatments often include a wide range of natural therapies, such as clinical nutrition, herbal medicine, homeopathy, hydrotherapy, physical medicine, including massage and manipulation, and lifestyle counseling. NDs spend significant time with their patients, conducting thorough assessments to understand their unique health history, lifestyle, and environmental factors. They then develop personalized treatment plans that address the root causes of illness and support the body's natural healing capabilities. Education and empowerment are central to naturopathic care, as patients are taught how to take responsibility for their own health. Naturopathy offers a holistic and patient-centered approach, aiming for long-term health and vitality rather than just symptom suppression. Ayurveda, ancient Indian healing Ayurveda, meaning the science of life, is an ancient holistic healing system that originated in India over 5,000 years ago. It is one of the world's oldest medical systems and is based on the belief that health and wellness depend on a delicate balance between the mind, body, and spirit. Ayurveda emphasizes a personalized approach, recognizing that each individual has a unique constitution or dosha, vata, pitta, kapha. Illness is seen as a state of imbalance in these doshas, influenced by diet, lifestyle, and environmental factors. The goal of Ayurvedic treatment is to restore this balance and promote the body's natural healing abilities. It is a comprehensive system of natural health. Ayurvedic treatments are highly individualized and include a wide range of therapies, such as dietary recommendations, herbal remedies, yoga, meditation, massage, e.g. abhyanga, detoxification procedures, panchakarma, and lifestyle counseling. Practitioners assess an individual's dosha through pulse diagnosis, observation, and detailed questioning to create a tailored treatment plan. For example, a person with a dominant vata dosha might be advised to eat warm, grounding foods, while a pitta individual might focus on cooling, less spicy options. Ayurveda emphasizes prevention and encourages daily routines, dinacharya, that support health and harmony. This ancient wisdom offers a profound framework for achieving optimal health and longevity through natural means. Its principles are increasingly relevant in modern wellness. Ethical considerations in practice. Ethical considerations are paramount in complementary healthcare, ensuring the safety, well-being, and trust of clients. Practitioners must adhere to a strict code of ethics that guides their professional conduct and decision-making. This includes maintaining confidentiality, respecting client autonomy, and practicing within the scope of their training and competence. Ethical practice builds a strong foundation of trust between the practitioner and the client, which is essential for effective therapeutic relationships. It also protects vulnerable individuals from potential harm or exploitation. Upholding high ethical standards is a non-negotiable aspect of any healthcare profession. Key ethical principles include informed consent, where clients must be fully informed about the proposed treatment, its potential benefits, risks, and alternatives before agreeing to it. Confidentiality ensures that all client information remains private and protected. Professional boundaries must be clearly established and maintained to prevent dual relationships or conflicts of interest. Practitioners also have a duty to refer clients to other healthcare professionals when a condition is beyond their scope of practice or requires conventional medical attention. Continuous ethical reflection and professional development are vital to navigate complex situations and ensure the highest standard of care. These principles safeguard both the client and the practitioner. Professional standards and regulation. Professional standards and regulation are essential for ensuring public safety, maintaining the credibility of complementary healthcare professions, and fostering public trust. In many countries, various complementary therapies are subject to regulatory bodies that set guidelines for education, training, practice, and ethical conduct. These regulations help to protect clients from unqualified practitioners and ensure that services meet a minimum level of quality. Adherence to these standards is a hallmark of a reputable and responsible practitioner. It also helps to differentiate legitimate therapies from unproven or potentially harmful practices. Understanding the regulatory landscape is crucial for any aspiring professional. Regulatory frameworks can vary significantly by country and by specific therapy, ranging from statutory regulation, government-mandated, to voluntary self-regulation by professional associations. These bodies often require practitioners to complete accredited training programs, maintain professional insurance, and engage in ongoing continuing professional development, CPD. They also provide mechanisms for addressing client complaints and enforcing disciplinary actions. For practitioners, being registered with a recognized professional body demonstrates a commitment to high standards and ethical practice. This commitment not only benefits clients, but also enhances the overall reputation and acceptance of complementary healthcare within the broader health system. Staying informed about current regulations is an ongoing responsibility. Client assessment and consultation. Effective client assessment and consultation are foundational to providing safe, personalized, and effective complementary healthcare. This initial stage involves gathering comprehensive information about the client's health history, current symptoms, lifestyle, diet, emotional state, and expectations from the therapy. A thorough consultation allows the practitioner to understand the client as a whole person, identifying potential root causes of their health concerns rather than just focusing on isolated symptoms. It also helps to establish rapport and trust, which are crucial for a successful therapeutic relationship. The quality of this initial assessment directly impacts the efficacy of the subsequent treatment plan. During the consultation, practitioners utilize active listening, empathetic communication, and skilled questioning techniques to elicit relevant information. They also conduct appropriate physical assessments, such as pulse or tongue diagnosis in TCM, or palpation in massage therapy, depending on their modality. It is vital to identify any contraindications or red flags that might require referral to a conventional medical professional. The consultation also serves as an opportunity to educate the client about the proposed therapy, ensuring informed consent. By taking a holistic approach to assessment, practitioners can develop tailored treatment plans that truly meet the individual needs and goals of each client, promoting optimal outcomes and empowering the client in their health journey. Treatment planning and customization. Following a comprehensive assessment, the next critical step in complementary healthcare is developing a personalized treatment plan. This plan is not a one-size-fits-all approach, but is carefully customized to address the unique needs, goals, and health profile of each individual client. It integrates the information gathered during the consultation with the practitioner's knowledge of various therapeutic modalities. Effective treatment planning considers the client's preferences, lifestyle, and any existing medical conditions, ensuring that the proposed interventions are both appropriate and sustainable. The aim is to create a roadmap for healing and well-being that resonates with the client. Customization involves selecting the most suitable therapies, determining appropriate dosages or frequencies, and setting realistic expectations for outcomes. A treatment plan might combine several modalities, such as nutritional recommendations alongside acupuncture, or herbal remedies with mindfulness practices. It should also include practical advice on lifestyle adjustments, such as stress management techniques, exercise recommendations, or sleep hygiene. Regular review and adjustment of the plan are essential, as a client's health status and needs can evolve over time. By empowering clients to actively participate in their treatment journey, practitioners foster greater adherence and more successful long-term results. This collaborative approach is a cornerstone of effective complementary healthcare, leading to truly holistic and individualized support. Safety and contraindications. Ensuring client safety is the paramount responsibility of any complementary healthcare practitioner. This involves a thorough understanding of potential risks, adverse reactions, and contraindications associated with each therapy. Contraindications are specific conditions or factors that make a particular treatment or procedure inadvisable, as it could cause harm to the client. For example, certain essential oils are contraindicated during pregnancy, and deep tissue massage might be unsuitable for individuals with specific circulatory conditions. Ignorance of these factors can lead to serious health consequences for the client. Diligent screening and ongoing assessment are therefore crucial. Practitioners must conduct a detailed health history intake and continually reassess the client's condition before and during each session. This includes asking about medications, allergies, existing medical conditions, and any recent changes in health. It is also essential to be aware of potential interactions between complementary therapies and conventional medications. In cases where a contraindication is identified, the practitioner must either modify the treatment, choose an alternative therapy, or refer the client to a more appropriate healthcare professional. Ethical practice dictates that client safety always takes precedence. Continuous education and staying updated on research are vital for minimizing risks and providing the safest possible care. This proactive approach protects both the client and the practitioner's professional integrity. Research and evidence-based practice. Research and evidence-based practice, EBP, are increasingly important in complementary healthcare, providing a scientific foundation for therapeutic claims and guiding effective clinical decision-making. EBP involves integrating the best available research evidence with clinical expertise and client values. While many complementary therapies have ancient roots, modern research helps to understand their mechanisms of action, efficacy, and safety. This scientific scrutiny is vital for gaining broader acceptance within the mainstream healthcare system and for ensuring that practitioners offer treatments that are genuinely beneficial. It moves the field beyond anecdotal evidence towards verifiable outcomes. Practitioners are encouraged to stay updated with the latest research findings relevant to their modalities. This includes critically appraising studies, understanding research methodologies, and interpreting statistical data. Evidence can come from various sources, including randomized controlled trials, systematic reviews, and meta-analysis. Integrating this evidence into practice means making informed choices about which therapies are most likely to be effective for a particular client, considering their individual circumstances and preferences. EBP not only enhances the credibility of complementary healthcare, but also empowers practitioners to provide the highest quality of care, continually refining their approaches based on robust scientific understanding. It is a dynamic process of continuous learning and improvement. Marketing and business management. For complementary healthcare practitioners, understanding marketing and business management principles is crucial for establishing and sustaining a successful practice. Many practitioners operate as independent business owners, requiring skills beyond their therapeutic expertise. Effective marketing helps to reach potential clients, communicate the value of their services, and build a strong professional brand. This involves identifying a target audience, understanding their needs, and crafting compelling messages that resonate with them. A well-executed marketing strategy is essential for attracting new clients and retaining existing ones in a competitive market. It allows practitioners to share their unique approach to healing. Business management encompasses various aspects, including financial planning, scheduling, client record keeping, legal compliance, and customer service. Developing a clear business plan, managing finances effectively, and setting appropriate pricing are fundamental for profitability and growth. Building a professional online presence through a website and social media, as well as networking with other healthcare professionals, are also vital for practice development. Excellent customer service, including clear communication and a welcoming environment, fosters client loyalty and positive word-of-mouth referrals. By mastering these business skills, practitioners can ensure the longevity and success of their practice, allowing them to focus on what they do best, helping people achieve better health. It transforms a passion into a sustainable career. Continuing professional development. Continuing professional development, CPD, is an ongoing process of learning and development that professionals engage in throughout their careers to maintain and enhance their skills, knowledge, and competence. In the dynamic field of complementary healthcare, CPD is not just a recommendation, but often a mandatory requirement for maintaining professional registration and ensuring the highest standards of client care. The healthcare landscape is constantly evolving, with new research, techniques, and ethical considerations making continuous learning essential. CPD ensures that practitioners remain current, competent, and capable of adapting to new challenges. It reflects a commitment to lifelong learning and professional excellence. CPD activities can take many forms, including attending workshops, seminars, and conferences, undertaking further qualifications, engaging in online courses, reading professional journals, participating in peer supervision, or conducting personal research. These activities help practitioners to deepen their understanding of their chosen modalities, explore new therapeutic approaches, and refine their clinical skills. Documenting CPD hours is often a requirement of professional bodies. By actively engaging in CPD, practitioners not only fulfill their professional obligations, but also enhance their expertise, expand their service offerings, and ultimately provide better outcomes for their clients. It is an investment in both personal growth and professional credibility, fostering a culture of continuous improvement within the complementary healthcare sector. Case studies in complementary care. Case studies are invaluable tools in complementary healthcare, offering detailed accounts of individual client experiences and the application of specific therapeutic interventions. They provide practical examples of how theoretical knowledge is translated into real-world practice, illustrating the complexities of client assessment, treatment planning, and outcome evaluation. Case studies help practitioners to develop critical thinking skills, learn from diverse clinical scenarios, and understand the nuances of various conditions and client responses. They are particularly useful for demonstrating the holistic and individualized nature of complementary therapies, showcasing how different modalities can be integrated to achieve positive results. Analyzing these narratives enhances clinical reasoning. Each case study typically includes a comprehensive client history, details of the presenting complaint, the chosen therapeutic approach, the rationale behind treatment decisions, the client's progress, and the final outcomes. They often highlight challenges encountered, adaptations made, and lessons learned. For example, a case study might detail how a combination of nutritional therapy and acupuncture helped a client manage chronic fatigue, or how reflexology alleviated anxiety in a patient undergoing cancer treatment. By examining these real-life examples, students and practitioners can gain deeper insights into the practical application of their skills, refine their diagnostic abilities, and build confidence in their therapeutic approaches. They bridge the gap between academic learning and clinical reality, offering rich opportunities for reflection and discussion. Future trends in complementary health. The field of complementary healthcare is constantly evolving, with several key trends shaping its future. One significant trend is the increasing demand for personalized and preventive health solutions, driven by a growing public awareness of holistic well-being. This pushes practitioners to offer more tailored approaches that consider individual genetics, lifestyle, and environmental factors. Another trend is the greater integration of complementary therapies into mainstream healthcare settings, moving towards truly integrative medicine models. This collaboration promises to enhance patient care by combining the best of both worlds, fostering a more comprehensive and patient-centered approach to health. Technology will also play an increasingly vital role. Further trends include the growing emphasis on evidence-based practice and scientific research, which will continue to strengthen the credibility and acceptance of complementary therapies. Digital health tools, such as telemedicine platforms, wearable devices, and AI-powered diagnostic aids, are also set to transform how complementary care is delivered and monitored. There is also a rising interest in mental health and stress management, leading to increased adoption of mind-body therapies. Finally, global health challenges and environmental concerns are driving a renewed focus on sustainable and natural healing practices. These trends collectively point towards a future where complementary healthcare is more accessible, integrated, scientifically supported, and central to a holistic approach to well-being. Practitioners must adapt to these changes to remain relevant and effective.